Hello everybody, welcome back to VMC. I am Dr. M. Today we're going to cover the most frequent questions I get surrounding euthanasia. We will talk about ways to assess when it is time, what the actual procedure usually involves, and how you can prepare yourself, your family, and your other pets for the euthanasia of one of your pets. I understand that this is a sensitive topic and isn't right for everybody, so if you do not wish to watch this, please click away now. It's most important to take care of yourself first, and we will see you on another video. And to everyone else, join me, you'll learn something today. The word euthanasia comes from Greek and generally means good death. And this is very important for us to remember because we need to offer an ending of suffering and a prevention of suffering when there isn't any other viable option for our pets, so that they can have a humane, pain-free, minimally stressful death that relieves them from suffering and prevents them from further suffering. So now that we know what the word means and the goal of euthanasia, let's talk a little bit about how to assess when it's time. This is such a common question that I get, and I refer clients to a quality of life assessment tool. There are several of them out there. The one that I tend to go to first is from Ohio State University College of Veterinary Medicine. They have a fantastic site, I'll link it down below. It's called Honoring the Bond, and it discusses how to know when it's time, how to talk to children about this, how to find support during grieving for yourself, and also what other pets in the household might experience after the euthanasia procedure, because other pets definitely grieve too. And so it's quite a comprehensive resource, and one that I find really does a great job of making it clear when helping to assess quality of life for our pets. However, Lap of Love has a quality of life assessment tool, and there is another one that is 5 H's and 2 M's, and that is also another good assessment of quality of life. And it can be helpful for people to look at a few of them, or even to fill out a few of them, so that they can have a more well-rounded idea of how their pet's quality of life is doing. And it's also important to have multiple people in the household fill these out as well, because each person will have different interactions with the pet, and it's important to keep that in mind when assessing quality of life. I also want to note here that I assess quality of life for my pets from the moment I get them. When they first join the household, I might assess it more often because I'm learning what makes that particular pet happy, what causes that particular pet stress, how I can better help them with cooperative husbandry training and that sort of thing. And then if they're healthy, then I will do a quality of life assessment about every year. And as they start aging, and we start seeing them being like middle-aged and then senior, I increase the frequency of the quality of life assessment. And this should happen for your pets as well. You might, for a senior, be assessing their quality of life every month. Then if you know that they're having an issue that is progressive, a health issue that's progressive and that will affect their quality of life, you'll want to get even more frequent than that. You can go up to every week, then a few times a week, and then eventually you will want to be assessing their quality of life daily when you are thinking that their quality of life has come down some, and you're worried that it's reaching the point where they are suffering and where euthanasia is in their best interest. It's also incredibly important for us to remember that good deaths, peaceful deaths, they rarely happen at home naturally. I hesitate to use that word, but that's often the word that clients use. When pets are left to suffer and die at home, It often means that they starve themselves to death, they end up having seizures that kill them, they might struggle to breathe and feel like they're drowning or being choked, and they rarely to never just peacefully die in their sleep like people hope their pets will do. That's just not reality, and so we need to move away from thinking that that is a goal, because it just doesn't happen very often at all. And so it is far better for us to intervene when our pet is having a lot of suffering, prevent further suffering, and give them a humane and dignified death. We should also remember that it is important to tell children what is going on. Of course, you should be age appropriate about it. However, it's important to avoid using put to sleep or go to sleep, as that can cause children to be fearful of nighttime and sleeping, or of anesthesia, surgical procedures, that sort of thing. It can cause confusion and fear. We need to be clear and say things like, Dr. M is going to help Fluffy die, or help Fluffy peacefully die, and then explain that Fluffy is currently suffering and that it is a responsibility of someone who has a pet to prevent suffering and to put an end to suffering that we cannot fix. And this is an important lesson for children to learn. There are also counselors and social workers that focus on grief, and those professionals can be very helpful for adults, teenagers, children, everybody who's going through the grieving process, because losing a pet does affect us in a similar way as the grief that we feel when we've lost a human family member. And so it's important that we're kind to ourselves and get ourselves the support that we need from friends, from family, from professionals when we are dealing with the decision of euthanasia and after the euthanasia. Other pets in the household will also grieve. We know that they do go through that. It can be helpful for a lot of them to have the chance to interact with the deceased pet. Often it's not great to have them in the room during the actual euthanasia, as they can become distressed by the human emotions and get in the way and make things unsafe. And so that might not be the best option. You'll have to talk to your veterinarian about it. However, to give the other pets the chance to investigate the dead pet can help the other pets to understand what has happened. If you are going to do this though, I want you to be aware that the other pets may not want to go up and investigate, or they might do things that as a human we might find a bit jolting or upsetting, like they might step on remains, or they might just completely ignore them and want to leave. All of those interactions are perfectly normal for other animals to do, and so it's important as the humans that we don't have expectations for how the other pets are going to react. We can just offer them the chance to know what has happened to their friend, and then whatever they choose to do after that, we just have to let them do and be okay with that ourselves. So if you think that you are not going to be okay with, say, another pet not wanting to investigate or not wanting to go near, then it might be best to not let the other pets come up. But this is a very individual thing, and so definitely discuss it with the veterinarian who will be doing the euthanasia and see if you can figure out some sort of way that's best for your particular situation. Once the other pets understand that their friend has been euthanized and is dead, they can go through a period of grieving and depression. It's important to keep your schedule as similar to before as possible, because the pets will rely on that to kind of know what's going to happen next and to reduce stress in other areas of their life while they're dealing with the grieving stressor. It's also important to spend extra snuggle time paying attention to them if they like that sort of thing. Not all pets do, but if they like it, some pets might just want to be near you more. Other pets might want more petting or touching. It will depend on your individual pet. And it's also important to make sure that you continue those sniffaries where you let another dog sniff everything that they like for as long as they like, make the walks and excursions about them and go at their pace and where they wish to go, as long as it's safe, of course, because that smelling reduces stress. We have research about this, and the exercise will also help to support their appetite, because some of the pets will have a reduced appetite as they're grieving. And so if you are noticing that despite spending extra time with them and keeping a similar schedule and doing the sniffaries, that your pet isn't eating, especially if it's a cat, that's a really big deal, then you need to contact your veterinarian and they can prescribe medications for stress like gabapentin and trazodone. Those are very commonly used for situational stress, and they can be used short term to help other pets as they're going through the grieving process. You can also trial the over-the-counter options of Adaptil and Feliway as pheromones, or Zilcan. It's a capsule that you can sprinkle over the food for them to eat. Those can help to reduce small amounts of stress for some pets as well, and just give them time to grieve and comfort them as they're grieving. Veterinarians support euthanasia for animals because it is tantamount as the beings responsible for them that we offer a humane ending of suffering and a good death whenever we are able to do that, to give that last gift to our pets who have done so much for us throughout their lives. A humane ending of suffering, when it's in the animal's best interest, is very hard on the humans. It's never an easy decision to make. It's never an easy thing to go through. However, it's very important to keep the animal's best interest at the center of the conversation when you're discussing this with your veterinarian, with your family, and when you're trying to decide when it is right for your animal. Now, do know that I have had countless people tell me they regret waiting too long. Make sure you're doing these quality of life assessments to prevent yourself from falling into that camp. I have never once, not once, had someone tell me that they regret euthanizing too early. I know that's a fear that people have, but it's not something that we see in reality. The fear and regret that people have is that they've waited too long. All right, I think that's all that I have for today. Feel free to share this video with anybody you know who needs some more information about when it might be the right time. All right, we will see you on the next one. Bye for now.